Joining us now is Hollywood publicist Howard Bragman, who represents two of the stars of the Real Housewives of Beverly Hills, and Dr. Janet Taylor, a psychiatrist who works with the Jeremy Kyle Show, a program where everyday people resolve their problems on TV. Thank you both.
Thank you
very much. Howard, you know, a lot of people are saying it's because of the show. They're pointing to the show and saying that that led to the suicide. What do you think?
I'm just not buying it, Robin. You know, ultimately Russell Armstrong has to take responsibility for his life and his death. He wasn't a really wonderful guy, and what the reality situation does is shine a lot of light on that. And if you have skeletons in your closet, they're going to come out, and that's exactly what happened to him. People take fame so callously in this country. They say it would be great to be on a reality show, but if you haven't lived a perfect life, you can bet that in this transparent world, bad news is going to get out there.
And I see, Dr. Taylor, you're shaking your head in agreement, and there's something that Russell said, and he said this show has literally pushed us to the limit. He said that, Russell Armstrong, to People magazine. Talk to us about the psychological effect it has on someone watching your life play out on television like that.
Well, reality is real people and real problems, but I think the bigger issue here is what pushes people to suicide, and certainly he fit the risk factors for it. He recently got a divorce, he had financial pressure, and then he did have the stress of the show, and certainly added stressors play a part. But most people who commit suicide have an underlying mood disorder, whether it's depression or bipolar disorder, and I think we can't lose sight of that fact and not comment on how he was personally, but understand this was the tragic loss of a life and really look at how we can prevent that from happening.
Looking at the bigger issue here and not making it solely about being on a reality show, but should people be screened a little bit better going on these programs?
Well, most people are screened, and certainly with reality, I mean, we want to see over-the-top personalities, which may not highlight how they cope, but most people are screened on reality shows, and unfortunately, you know, suicidality can be impulsive in this case. We don't know the underlying factors, but I think we can't knock off all reality shows because one individual unfortunately chose to end his life.
And we don't know, Howard, what Bravo is going to do at this point. We heard Andrea say they're deciding whether or not, because right now it's scheduled to come back in a couple of weeks. How do you have the program back on? And he is very much a part of it, Russell Armstrong, the program.
Oh, absolutely. I think you handle it with great dignity and great respect. The last thing you want to do is appear to be exploiting this, but you also don't want to avoid this, and hopefully Janet's right. You can really shine a light on some of the issues and maybe see some of the issues that led up to this, and if we can help other people deal with their problems before they get this bad, that would be a great benefit from this show, and I think it can really do that.
As we said, you represent two of the women that are on the program, and when you talk to a client, what do you tell them about going on a program like this and how to be prepared for what could happen?
I tell them to go in with their eyes wide open, that reality TV is not always reality, that there are going to be situations, there are going to be pressures, and you have to have a really good center. You have to have a really good balance and understand who you are, what your personal limits are, and be willing to draw a line in the sand. If the producers say, we want you to do that, you have to say, no, that's not me,
sometimes
and that's not authentic.
But sometimes it's difficult for them because they're always trying to one-up the other, it seems. And Dr. Taylor, you work on a program where everyday people can come on and solve their problems. It's how difficult that is it, though, to come on television and to expose your issues like that?
You know, what I found is that most people don't communicate, and so whether it's a doctor's office or whether it's an office on a TV show, the opportunity for people to talk is important, and I think you have to have parameters in terms of knowing who's maybe at risk to not come on and expose themselves, and certainly we screen for individuals who may be psychotic, who may be suicidal, who really may not be together enough to really push the limits. And I think that's what we have to be conscious about, especially as technology and social media. We are blurring the lines between reality and boundaries, and we have to keep that center, as Howard said, and come in with your eyes wide open, because for most people it's a choice to come on a TV show.
Excellent points from both of you. Dr. Taylor, thank you. Howard, thank you very much. We appreciate it.